In this video, you will learn what happens with your baby this week, what happens to your body, things to do or consider this week. Feel free to leave a comment if you have questions. In week 20, your baby will swallow more and more amniotic fluid. This is a good exercise for digestion. Your baby also starts producing meconium. This is stool that is usually black and sticky. After birth, you often see this in your baby's first diapers. At 25.4 centimeters and 303 grams, your baby is as big as a carrot and as heavy as a pair of slippers. Surprisingly, the pregnancy hormones have a good side effect on your hair and nails. You'll notice that your hair is fuller and your nails stronger. That is, of course, a rather nice side effect. Enjoy it while it lasts, because once your baby is born, all that extra hair will fall out. Nausea and dizziness will probably still bother you a lot. These ailments are not only annoying, but can also be very dangerous. For example, think about what could happen if you get dizzy while driving. It is difficult to prepare for such moments. Do you drive regularly and also regularly suffer from dizziness? Perhaps it would be good to think about other solutions. This way you can see if there is a colleague with whom you can carpool. Another painful ailment that you can suffer from when you are about 20 weeks pregnant: cramps in your legs. This often comes on when you sleep, causing you to wake up with this terrible pain in your leg. To get rid of it as quickly as possible, it's best to stretch by pulling your toes up towards your shin and repeating this a few times. From about 13 weeks of pregnancy, there is an increased chance of vaginal discharge. This discharge is usually white or brownish in color. The brownish color might be due to some blood that may be in it. As long as these are small amounts with no bright red blood in them, this is normal. Although the discharge can make you feel uncomfortable, it is very important for your baby. This protects the uterus and therefore your baby against infections. Typically, it's a good idea to have an ultrasound at 20 weeks pregnant. During this very extensive ultrasound, your baby will be checked for any abnormalities. You will already have had a meeting with your obstetrician or gynecologist at the beginning of your pregnancy. You can then decide for yourself whether you want to have this extensive ultrasound performed or not. It is good to consider this at this time.